So far we've talked about diagnostic testing associated with normal physical exams and normal annuals in dogs and cats. We do many very simple tests though here in the clinic that are associated with animals that have anywhere from ear problems to skin problems to serious illnesses such as kidney disease and liver disease. Primarily at this clinic, as far as skin testing, we'll actually do skin scrapes, and we'll actually do, believe it or not, Scotch tape preparations where we actually are looking for yeast. We look for yeast and bacteria on skin surfaces. We look for parasites when we do skin scrapes. Everybody's heard of the mange, and there's two types of manges. The primary test for that is where we actually scrape the skin. We take that material that we scrape off, combined with some mineral oil, we look at it under the microscope and actually physically look for the mite. On our skin scrape, we see two primary mites. That's what we're looking for. We have the demodectic mite shown here. There are two parasite illustrations right here. This is the mite themselves. This is actually a better shot of it right here. What's kind of interesting, when you see these on the microscope, you can see all these little eggs, and they're all swimming and walking around. These little suckers make everybody itch when they look at them under the scope. The other mite that we talked about is the sarcops mite, the sarcoptic mange, and this is one that is also contagious to humans. This is an illustration, but it's a little bit fuzzy. It's not totally in focus, and that's because the mite has dimension. Part of the mite is in focus, the other part of it is not. This particular mite is one that will cause tremendous itching on dogs and cats and also on people. Ears give us an opportunity to do some different testing. The primary testing that we do here in this clinic is going to be a cytology, or we actually take a smear of the discharges down in the ear canal of the dog or the cat. These itchy dogs that are constantly flipping their head, scratching at their ears, those are indications that we do have problems that are a little bit further in. We take a sterile Q-tip and actually go down into the canal itself, and then we take that material out, very similar to what we did with the skin scraping, and we apply that material to a slide. Once it's on the slide, we actually take a lighter and we heat fix it. We want that material to stick to the slide. At that point in time, we'll stain it. We'll use specialized staining. It takes about a minute to do a complete staining. And we'll go in there and we're looking for bacteria count, yeast count, and any other material that might be in that ear that might give us an indication of what's going on. Here we have a picture of an ear mite. It's a very similar mite to the skin scrape that we saw was a sarcoptic mite. This little mite causes a tremendous amount of irritation in the ear canal, along with bacteria and yeast that we do see in the ear. It's this particular mite that so many of us think that is causing problems in the ear, but the reason for testing and looking in the ear, taking swabs and examining the discharge from the ears under the microscope is to determine the difference whether we have a mite problem, a yeast problem, or a bacteria problem. Once we've determined whether we have a yeast or a bacterial infection or if it's a chronic infection, we will take that material and do a sterile swab. We'll take a special swab, go down in those ears, remove the material and put it in a media. It will be a tube that's specially designed to help promote the growth, or it preserves the bacteria that's in that ear canal. That particular test is done and sent into IDEXX laboratories, and we wait for their results, but that is an outside laboratory test.